committee has written to the top 4 supermarkets to ask them to come and see us. They seem to be perpetually busy, but we urge them to take up our offer. We really do want to talk to them in a constructive manner. So I hope they are listening. Dr. Becky Cooper.
Thank you, Chair. I hope they're listening too, because we're going to talk about price. So can I ask you about price elasticity? So where we are now, obviously, is in a particular world where, as you have alluded to, there are incentives, perhaps price incentives, to buy food that we would define as not particularly healthy. And there have been previous governments who have aimed to sort of ban volume promotions and enter into agreements with supermarkets. I just wondered, as a panel, how successful you think this has been to date. And if you could just comment on that sort of price elasticity, how far do you think we can push it with consumers? Do we do it in a sudden way, or do we do it gradually? What do you feel would be most effective? I don't know who wants to talk to this. Yes, go for it, Lauren.
I'll go first. So in our work on health targets for supermarkets, which I've mentioned already and inspired the government's healthy food standard, we worked with an independent economist in that work to assess the impact of the policy. And why I mention this is because obviously one of the mechanisms that supermarkets can use to achieve the target would be altering their pricing strategies or their promotional strategies. What we found is, given the nature of the grocery retail market, it's incredibly price sensitive, and that means that supermarkets are often competing with one another to win over consumers, and therefore pricing becomes really important to that. The Grocer, I think it was a couple of weeks ago, published an article that showed that Tesco was able to reduce the overall cost of an average basket by 11% to meet Asda. So that shows that supermarkets do have the tools and powers to alter the price of food for the benefit of the public, and that can be done in order to improve healthiness as well.
And Lauren, just to push that a bit, what would incentivise them to do that?
I mean, I'm going to mention the healthy targets for supermarkets again, because we think it is a really neat policy, because it incentivises some of the mechanisms that we've talked about today. So there was mention earlier of placement and promotional restrictions. You mentioned that yourself. And what a target does is incentivise all of those different types of behaviours in one mechanism. But it is up to the supermarket to choose for their business model, which is likely to be more effective. So each supermarket has a slightly different model. For one, that might mean they change the recipes of their in-brand food. For another, it might mean that pricing is really important to them, and therefore they focus on that in order to achieve the health target. I think that's really kind of compelling in this.
Okay. I absolutely hear you. So I suppose we go back to where we are today. Yeah. So I wonder if it's fair to say that the incentive to ensure that our population is nutritionally healthy isn't particularly driving supermarkets. Otherwise, based on what you say, based on the fact that the majority of our food is purchased from supermarkets, we would be a much more nutritionally healthy population if it's very price sensitive. So I suppose we've been having these conversations for 10 years, 20 years, however many years. So in 10 years' time, what is the conversation now around price with supermarkets that will make the difference? That in 10 years' time, we're not having this conversation anymore, because it feels like the same conversation that we're having. Yeah. Do you want to come in? I can see Chris looking.
Well, I'd just say really quickly first that hopefully in 10 years' time, the healthy food standard, including the health targets component of it, would have been in place. And over that time, there would have been adjustments to that to make it, over time, improve it further and further, so that gradually 80% of the food that we consume comes from supermarkets, so that over time, that majority of the food that we're consuming would be healthier, and there'd be a continued push to keep making it healthier.
And forgive me, Lauren, because we have been having this conversation for 20 years. The conversation's not changed. So it's almost like we're starting at day one and we've forgotten what's gone before.
We also haven't had the regulations in place, so we've only just got the promotions and placement in place as well. So
thank you. So interesting. The conversation's been going, but we feel like we're at ground zero.
Yeah.
Okay. Christina.
Yeah, so one of the key failings that has happened is that policies have been made in one by one. So we're dealing with one problem, we're dealing with the next problem, we're dealing with the next problem. So we've got calorie labelling, we've got food groups for school food standards and Eat Well guides, and now the new early years guidance. We've got HFSS for manufacturers, we've got calorie reduction for, there is just so many things that it's not joined up. We really need a joined up regulatory framework from which we can refine regularly because it's mandated in law. So every 3 years the evidence is reviewed and it's updated. The danger with the mandatory reporting is it's excellent and it should come in and it's wonderful, but it needs to be joined up. So the HFS element is joined up, but that sort of average marker on its own won't be sufficient. We know that marketing is the combination of product, price, placement and promotion. We need to be tackling all of those things and not just supermarkets. Yes, a bulk of our food does come from supermarkets, but there's a growing proportion that's coming from out of home. We also see it in public sector, schools and early years. We really need to be joining up all of that, toddler and infant food in addition. So we really need a regulatory framework from which all of that can stand.
And I think we'll come to all those policies in my colleagues' questions next. I just want to go back to price. For example, if a decision were made tomorrow saying, right, what we're going to do is we're going to subsidise healthy food, properly healthy food, nutritionally valuable food, to make that food much cheaper, and we are going to tax the heck out of really unhealthy food, so that has to become more expensive. Do you think that would have a significant effect on the nutritional intake of our population? And I suppose my other question is it equitable? Because that's the other problem here as well.
Well, I think Christina's mentioned justice. Justice is your starting principle. So if you start going, we want to reduce ultra-processed food, if that's your goal, you're going to do all kinds of things that are unjust and unequitable. If you start with the fact that we have a deeply unjust food system where people are essentially forced to eat unhealthy food, then you can't really go wrong, provided you shut the people who are causing the injustice out of the room writing the policies. So in terms of these specifics, I think the mandatory reporting stuff is excellent. Of course, it should be done. It is about number 10 on the list of stuff that will really, really make a difference. There is not one single instance I can think of in the history of commercially determined public health problems, lung cancer, asbestos, lead in petrol, seat belts. There's a list of stuff, CFCs, there's a list of stuff we've sold. In every single case, it was a mixture of aggressive mandatory policies that encompassed a lot of different aspects of the problem and strategic litigation. So in this case, the solutions where we go, supermarkets will be incentivised if we kind of expose their shame. Everyone knows that supermarkets sell unhealthy food, because when you go into a supermarket, you can see it, and we're all, or a majority of us, live with diet-related disease now. The same is true of lots of our junk food restaurants that really mainly sell junk food, and it doesn't particularly shift consumers, and it doesn't seem to shift corporate behaviour. So the companies will be our partners in this. They will come in here and they will make extravagant promises, as they did 10 years ago and 20 years ago and 30 years ago, as the cigarette companies did between 1955 and 2005. For half a century they promised to change, they promised to fund science, do all kinds of things, but in the end, the suite of policies you need is fairly straightforward. You need warning labels that determine unhealthy products using strict definitions. Progressive taxation really, really works. It's brilliant, and it goes hand in hand with strict marketing restrictions, and then a whole load of other policies that promote healthy food and restrict unhealthy food in schools. This stuff is not, I think everyone on this committee could write down your top 6 to 10 policies, and mandatory reporting of unhealthy food would creep in there if you did 10, but it's not going to shift the dial. The companies, you cannot understand, the harmful food is the business model. It's the way they make their money. In order to make money from food, you can only do two things. So Tesco versus Asda, they've got two problems to solve. They can drive down the cost of ingredients, or they can sell more food. That's all. The other costs are baked in: labour, energy, everything else. So if you engineer your products using brain scanners, and you engineer your products using very, very advanced scientific development techniques, many of which were inherited from the cigarette industry, then you sell masses of food. And that's why my kids do not leave a single Cocoa Pop left in the bowl or on the table. They eat every last one. And all of us here have had the experience. No one ever eats 2 slices of the bread. You open the pack of crunchy stuff, you open the pack flat, and you lick it out with your finger. And that's not because you're weak, lazy individuals. It's because the food has been engineered by teams of geniuses over decades using advanced scientific technology. So, yes, mandatory reporting, brilliant. companies are going to promise the earth and resist change at every step of the way, which is what we've seen over the last 2 decades.
Thank you. Great.